Hello, good morning. So this is a unique video because I'm about to do a review of a Netflix documentary that I just watched. It's called Take Your Pill, and it's certainly interesting, and I am curious to watch it because I know that my patients, my families that I work with, many of them are probably watching films like this or perhaps this exact film, and I want to know how what kind of information they're getting. I frequently also Google information on ADHD and medication for ADHD because I want to see what my patients are seeing. And so my take of the film Take Your Pill is that it's actually a very one-sided portrayal of ADHD and treatment for ADHD. And this documentary focuses primarily on the management treatments of ADHD and has a very critical attitude toward medication. It portrays medication as something that's very dangerous, it's highly addictive, and mind altering and frequently abused. And most importantly, I would say many of the information that's portrayed in the film are simply wrong from a medical perspective. For example, it seems to hint at the idea that it was very surprising that people without ADHD could benefit from the medicine too. But this is yet widely known. I mean, I think even non-medical personnel know about this and is aware that people take Adderall or medication similar to this to enhance their uh, ability to get things done. Uh, and I think most people are already aware that this is not a smart pill because it doesn't enhance your cognition per se. It helps you to control focus, control your impulses, controlling your emotions. But it doesn't increase your IQ. It cannot do that. There's no medication that can do that. And also it portrays it's damaging. One of the most annoying aspects of the film is that it says it can affect your liver function, it can affect your heart, it can affect your kidney. Yet in reality, it doesn't do any of that. I have seen patients, as I mentioned before in other videos, who has had undergone massive overdose of the medicine. Not that I recommend it, but I've witnessed many times. And they fare just fine. You don't even need to check their liver function and kidney function because we know that this medication does not affect organs and does not lead to organ failure. And regarding the addiction aspect of the medication, in more than 15 years of being a specialist in treating ADHD, I have never seen one single patient who was addicted to the medicine. As I mentioned before, also, usually the problem I'm faced with is that the patient doesn't want to take the medicine because of side effects. I've never had someone who just keeps on asking for the medicine when they actually don't need it anymore. And I'm also very cautious at diagnosing ADHD because, someone who doesn't need the medicine, you should not really be taking it because it does give you an edge up. So I just want to say this documentary, watch it with a grain of salt, and it's very biased. Um, and toward the end, it even portrays that okay, the better alternatives for taking stimulants for ADHD is perhaps using microdosing of the psychedelics like mushrooms and LSD. And this is, I would say, completely unproven. Maybe there is something to it, but I definitely say that there's more scientific research that needs to be done on this before we can hint that this is a better alternative to stimulants when it comes to treating ADHD. And one last thing is, toward the end, there's also a social commentary on the Western culture, on the very competitive environment that's created by capitalism. I have to say, I obviously am a doctor, so I went through college, medical school, and I myself have never taken a single dose of stimulants. I've been prescribing it for more than 15 years. I just never attempted to because There's really no reason. I can get things done. I know I don't have ADHD. I don't need the additional help, and I do understand that there are side effects associated. So it's not like you can have your cake and eat it too. There's a small price to pay for getting the benefit from stimulant treatments. And while I was in college or medical school, uh, I've never even heard of other people, my friends, roommates, classmates, family members, none of them have ever talked about taking medicine to help them focus better. This simply wasn't the case. And you can imagine the kind of environment that you faced in a very competitive um, situation in medical school. I was in college, both in college and medical school, I was consistently the top of my class. I never had to take any medicine to help me get there. I worked very hard, granted. And even in that milieu, I wasn't aware of anyone, any of my classmates, talk about taking stimulants to help them study. Granted, they may be taking it, just not telling anyone about it, but I'm just saying it's a far cry from having this pervasive culture of drug misuse, abuse in the college setting or in the, you know, the highly competitive investment banking field. Um, so, in short, I think this documentary is doing quite a disservice to the public because it portrays a very negative view of ADHD and ADHD treatment. Um, I think it handpicked certain, they call it expert on the topic for their view, not really trying to or even attempt to create a balanced perspective on ADHD treatment. And just watch it with a grain of salt. Definitely feel free to watch it. It's interesting to get all perspectives, but just have a balanced perspective and talk to your doctor and get the most reliable information from him or her. All right. Have a wonderful day. Bye bye.